So a lot of people at HIMSS09 are going to be wanting to talk about the high-tech legislation that's included in the stimulus package. And could you tell me what this legislation is going to do for healthcare providers in terms of IT?
Well, the biggest part of high-tech, as I understand it, and the caveat here is that I don't think anybody really knows what's inside the bill because so much of it remains to be spelled out in rulemaking. But essentially there's almost $21 billion for electronic medical record adoption, and most of that is paid to physicians or hospitals in the form of Medicare or Medicaid reimbursement. I think that's what everybody has their eye on right now, is that $21 billion figure, and trying to figure out, well, okay, if you're going to pay this out over 5 years, where does it leave me? And the short answer is it's about $2 million for hospitals, and somewhere between $44,000 and $60,000 for physicians over the course of the next 5 years.
Will the $44,000 to $60,000 for doctors be enough of an incentive for practices to start adopting, the right kinds of IT to be qualified for the program? Given that we've seen that $70,000 is the estimate for what a small physician practice would have to spend in order to get on the program.
I think the presumption that $44,000 is not enough depends on the concept that that's the only benefit that electronic medical records would provide the small practice. I mean, first of all, I think most physicians, and small physician practices, large physician practices, I think they all want to deliver high quality care. And if they want to do that, I think most realize that electronic medical records are going to do that, or do a better job providing care than paper records, especially in our fractured medical delivery system. So I think there are other benefits. You start providing higher quality care, your patients notice this, they will stay with you, they'll be loyal to you. There are other benefits as well. I've talked to physician practices who tell me they spend 5 figures on storage of medical records, paper records. And if you can close off your storage costs in a year, that probably makes up a lot of the gap between the $44,000 that the Act might provide and the $70,000 estimated that it's going to cost a physician practice to implement electronic records.
So the April Healthcare IT News issue comes out while we're at HIMSS09 this year. Can you give us a preview of what's going to be in the issue?
Yeah, it's a 72-page issue, and I think you could say the top 3 things that are being covered are high-tech and the American Recovery and Reinvestment Act. There are 2 or 3 stories about the implications for hospitals and physician practices. The other thing, of course, the big news when we were going to press was the appointment of David Blumenthal to the Office of the National Coordinator. He'll be replacing Dr. Kolodner in that position. And then the third thing is that the newspaper is just full of new products. Every vendor wants to release a great new product around HIMSS, and we get flooded with product announcements. We try to look at them and get them all into the newspaper, and in fact we can't get them all into the paper, so you're going to have to go to the website if you want to get the full list.
Will attendees at HIMSS09 have a chance to learn more about the high-tech legislation?
It would be hard to leave HIMSS without learning something more about the stimulus bill. HIMSS has created 11 new educational sessions that deal with nothing but high-tech or the American Recovery and Reinvestment Act. I think the Office of the National Coordinator has a town hall. You can bet that that's going to come up. Because remember that in order to access that money, hospitals and physician practices can't just buy any electronic medical record. They have to buy a certified record system. And right now, CCHIT, the Commission for Certification of Health Information Technology, is the only game in town. So Dr. Mark Levitt of CCHIT will be there. I'm sure he's going to be talking about it. Hopefully David Blumenthal will be talking about it. If not, Dr. Kolodner will be talking about it. And you will leave HIMSS overstimulated. I had to get that in there. Chip, while I have you here, or while you have me here, it's an interesting contrast. This is going to be your first HIMSS show.
It is going to be my first HIMSS show.
Anything you're looking forward to?
I'm looking forward to doing a lot of web journalism stuff. We're going to be shooting a lot of video, taking a lot of photos. We're going to be tweeting live from the show. the website is just going to be replete with HIMSS09 coverage while we're there, and I'm really looking forward to doing all that stuff and to meeting a lot of the people who I communicate with in our industry, whom I've never met face to face.
You know, it's funny because back in 2004, when I went to my first HIMSS show to cover the show, we thought we were doing a great service simply by getting news out on a daily basis, creating a daily newspaper at the show. But with technology today, you'll be posting news either to the website or to Twitter every hour, I would expect.
Yeah, it's going to be almost instantaneous.
And can people communicate with you while they're at the show?
Absolutely, yeah. I'll be in the MedTech newsroom for a lot of it, which is room W22A.
Mm-hmm.
I'll be, monitoring our Twitter feeds live while we're there. I'll be around the show floor.
Okay, so if people want to follow healthcare IT news coverage on Twitter, how do they do that?
Just go to twitter.com/HIT news tweet, and that's where we are, and you can see all the live updates we're going to be doing. We're going to be posting links back to the website, and things, pinging questions out to the people who are following us, and responding to some things that they're saying too. Also, if attendees want to get a chance to ask HIMSS Analytics a question that will then be answered in a video segment we're going to do, they should swing by the MedTech newsroom, W22A, and they can ask a question into our camera. We'll turn that question over to HIMSS Analytics, who will then answer their question on our website in the coming weeks.
Do you have a schedule worked out for that yet? I mean, can people go past at any time, or?
We're going to be there for a lot of time on Monday, Tuesday, and Wednesday, so chances are if you just drop in, we're going to be there, and we'll be able to fit you in. It won't take more than 5 minutes to answer your question.